A lot of people are experiencing exclusion from adequate healthcare, but how can we say that it is actually present? The efforts made to maintain or restore physical, mental, or emotional well-being, especially by trained or licensed professionals, encompass healthcare. To say that adequate healthcare is provided, it would mean that the needs of the individual or population with regard to his physical, mental, and emotional needs are all being met. In developing countries, the vulnerable are the poor as they are less likely to receive adequate healthcare than the people who can afford to pay for insurance. One of the reasons why there is no adequate healthcare in developing countries is that there is no proper distribution or allocation of resources. Also, it can be because there is more demand for healthcare than the country's supply for healthcare needs. National funds for health were cut this 2020, severing the problems in our healthcare sector more. A lot of people are still suffering or even worse, dying, even though there are treatments or cures available for such conditions. What is lacking is the means by which everyone can be provided with adequate healthcare, not just for the people who can pay. Let us take, for example, the measles outbreak here in the Philippines. According to WHO, the risk of an outbreak of measles rises when a community has insufficient immunization coverage. Communities have insufficient immunizations since inadequate service delivery continues to be a problem. These problems include less than the optimum number of primary care immunization sessions and accessibility issues, especially in hard-to-reach areas in the Philippines. Therefore, even before the pandemic, we can conclude that there is already an exclusion from adequate healthcare. The privatization of public hospitals will make the situation of our healthcare worse here in the Philippines. What we need in the Philippines are hospitals that can cater to the vulnerable, especially in these trying times. We should not exclude anybody when it comes to health. It should be accessible and affordable for the people. The number of senior citizens in the Philippines is rapidly increasing from 4.6 million in 2000 to almost a double of 7.55 million in 2015, a growth faster compared to the rise in the total population. This is alarming considering that our healthcare system cannot give free and adequate access.